Now let me show you how you can pass pharmacology, right? To understand pharmacology, you don't want to go like this. Now you want to go in step, right? Because if you go like this, you are going to be overwhelmed. You want to grow, you want to start growing in pharmacology, because when you decide to learn this way, you will miss out on a lot of information, right? That's the reason why I'm going to give you my 7 unique step in understanding pharmacology, right? 7 unique step in understanding pharmacology. The first part is to understand, right? You want to understand pharmacology, the basic principles of pharmacology. This way, you are now open to what to expect from pharmacology. Now, the second thing you want to know is the classes. Now, I tell a lot of students to learn 30 classes of medication, right? This cover everything you need to know for pharmacology. You'll be able to pass. I've been able to help more than 1,000 students pass pharmacology in the last 2 years, right? Be it you are taking it in nursing school, for the NCLEX, for medical school, pharmacies, yes, 30 classes of medication is what you need to know. Now, the next part you want to know is the uses, right? Now you have your class, you want to know the uses. Now I tell you to divide this 30 to 5 days, right? 5 days. So you have the um the 1, 2, 3, 4, 5. Now you can easily be able to learn six, 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 right? So you have 6 classes of medication. You are learning the uses, right? Now, very brilliant that way. Now you are learning the uses, which also bring me to um the fourth step, which is the MOA. Now I use this three system, right? Whereby I tell you to do this, right? You have your class right here, you have your use, right? And you have what? The MOA. Because you want to know the class, the use, the MOA. Let us say this is uh beta blocker. You just put beta blocker right here, beta blockers, you put the use and you put the MOA. Now you have 30 class, right? You know the use, you know the MOA. You just do that. You do 6 each day for 5 days, and then when you are done, you have a clear understanding. You've been able to cover 30 class of medication in just what, 1 week, right? Brilliant, right? Now when you are done with this, right, the fifth step is to know the side and let me use and we want to know the side and adverse effect. Now you are not knowing the side and adverse effect of the medication. Instead, you are knowing the side and adverse effect of the classes, right? What's the side effect and adverse effect of beta blocker, or what's the side effect and adverse effect of antihypertensive medication? What's the side effect and adverse effect of anti-diabetic medication? This is what you want to know. You are not knowing the medication yet. At this point, you are not knowing the medication. Remember, I said only the classes use MO. You are not trying to find out what are example of medication under each class. We are not doing that yet. Now we know the side effect and adverse effect. In this fifth step, I encourage the student to have a particular note, whereby this note, they are going to call it the adverse effect note, whereby all they just need to be doing is to, when they are getting the side effect and adverse effect of each of the um 30 classes, they want to take note of the adverse effect. So they are going to be writing the adverse effect. Now you are going to find out that you are saying some adverse effects that are related. You find out that some adverse effects are the same as some certain classes. But guess what? You are taking note of this adverse effect because question comes out from this area. The question come out from this area the most, right? So you want to take note of the adverse effect, because now if you are taking the NCLEX exam, question show up a lot from this area. Now you can be able to answer safety related question, whereby the question is asking you, a patient is on let me just say Adol, Which of the following finding require immediate what? Follow up. Now, what follow up mean that there's something about each of these finding that make one of them let me say that make one of these finding put the patient at risk, right? One of these findings is going to put this patient at risk, which is also known as the adverse effect. You are trying to follow up on what? Something that look like what? Adverse effect. Now, if you've completely take your note on adverse effect, you will find out that you will easily be able to answer this kind of question, and it show up on the NCLEX exam a lot, right? Nursing school exam as well too, because this will kill the patient, right? This what we just do when it comes to side effects, right? Side effects, we just want to allow the patient to know about it, but adverse effect, we want the patient to report to the doctor, right? Because this is going to kill the patient. This can make the patient uncomfortable, but this is the killer right here. Now, right, when you are done with when you are done with the aspect of side effect and adverse effect, now we now want to now know what the medications. Now, this way, even before we get to the medication, we are familiar with 70% knowledge that don't require the understanding of the medication, because now we know MOA, right? We can easily be able to identify the MOA, the use in the option, right? Even without not knowing the medication, right? We can easily identify the MOA, the use in the option, and be able to now guess that this is the function of this medication. So even if we don't know too much medication, at least we try as much as possible to know 100, right? Knowing 100, right? At this point, we've done all the work, right? At this point, we just want to be familiar with medication and be linking them to the class. Now, when we are done with this aspect, now the seventh part is to answer question, right? Question, and I do drill for my student drill. Now, at this point, whereby when we try to answer question, the question bank is 2,000 question. Now, the first 50, if you don't get all these 50 correctly, you will not be able to move to the next 50 question. So that way, even if you have not successfully known your 100 medication, right, or your 30 class, this aspect will drill in the information perfectly into you. That way you will be able to know them. So using this 7 step, right, when you finish the program under me, you'll be able to pass the pass any pharmacology question, because this way you've been able to understand a lot about pharmacology, right? If you want to do it by yourself, yeah, you can go ahead and do this 7 step yourself. It's going to help you pass the any pharmacology question, right? But if you want to do this by joining my special program, whereby I'm going to teach you how to pass pharmacology for any exam, right? I will be able to help you out. To join, you just need to pay a total sum of $100, right, to join the pharmacology program under me, and I will be able to guide you through the 7 step. If by 14 days you don't like what you are getting, right, you can just message me for a refund, and I'm definitely going to refund you. But I can guarantee you that you will not want to get a refund, because you are going to enjoy the process and be able to pass the any pharmacology question that come your way, right? So this is what I want to give to you. I want to give you the power to answer pharmacology in a way whereby you see pharmacology questions no more difficult anymore, and you can be able to pass pharmacology and you don't get scared of pharmacology. So if you are interested, just send me a DM, right? Just send me a DM with this keyword, right? Just send me a DM with this keyword farm, right? And I'm going to reply you shortly.